Time is a limited resource for the vast majority of people. So if I would rather you take your minutes and do your Kegel routine or take those minutes and do full body strength, I'd pick full body strength. In today's video, I'm going to be sharing my top 5 tips for fixing urinary incontinence while pregnant. As a pelvic floor physical therapist, I support a lot of prenatal and postpartum patients, and urinary incontinence is one of the top things that individuals come to see me for. Research shows that approximately 30 to 40% of women will experience urinary incontinence while they're pregnant. And I argue this statistic is significantly underreported because many women will not share this with their birthing providers or will be told that it's just a normal part of being pregnant. This statistic does not have to be your normal. The top 5 things I'm going to be sharing are actionable items that you can be looking into to help your own body overcome this so that you don't have to just deal with leaking while you're pregnant. Tip number 1 is making sure that you're getting enough adequate exercise during your week that includes both cardio and strength training. Lifting weights while we're pregnant is 100% supportive for your body, unless you have been told otherwise for a specific medical issue for you. But the general public actually really benefits from strength training, and that is what I am doing with my patients in my practice on a regular basis. In building more strength around the muscles of the pelvis, this will help to reduce the common aches and pains that people often experience in their low back, in their hips, and in their pelvis, as well as help individuals overcome the really common pelvic floor symptoms like leaking that often result during pregnancy. So if you're not strength training through your pregnancy, I highly recommend that you start doing so. And with my patients, I'm also recommending that they're aiming for approximately 1 hour of strength training a week, broken up in whatever way works for you during your week. Be sure to check out in the description below for some of my own videos regarding exercises and things that you can explore at home. Tip number 2. Stop focusing so much on Kegels. Hear me out for just a second. And if you've been practicing your Kegels, I'm going to invite you to just pause real quick, especially if you're doing them right now while this video is playing. Doing Kegels can actually worsen pelvic floor symptoms and increase leaking when done incorrectly. If someone already has a tighter pelvic floor, if they're trying to do Kegels, then that's actually tightening the pelvic floor even more, which can exacerbate your symptoms. So the best way to mitigate pelvic floor symptoms and to overcome them is not going to be just isolating contractions at your pelvic floor, but rather addressing the muscle strength that is needed around those larger muscles around the pelvis, because they are the ones that are working with your pelvic floor. So if you've been doing Kegels and haven't been feeling any results, I encourage you to swap them for squats instead. Tip number 3, making sure that you're maintaining enough hydration throughout your day. So it is super common for people when they are suffering with leaking symptoms to start withholding the amount of water or other beverages that they may be taking in the hopes that by not taking in so much water that they won't have to go to the bathroom so much and that will therefore resolve their leaking. I understand this logic, but actually withholding adequate hydration is going to perpetuate your leaking and pelvic floor symptoms. Hear me out. So if we're not taking in enough water, then we're also going to have more concentrated urine as a result. That can actually irritate the inside lining of your bladder, which can then also create more irritation to the pelvic floor and increase urgency frequency symptoms. So do yourself a favor and hydrate adequately throughout the day to be able to support your whole body and your pelvic floor. A good way to test if you're getting enough water is actually looking at the color of your urine. You want to be aiming for a light yellow in color more often than not. If it is much darker than that, then you know that you're dehydrated and you need to increase your water intake. Tip number 4, making sure that you're getting enough fiber in your day. So it is recommended that adults be getting 25 grams of fiber per day. However, most Americans are getting less than 10. This leads to an increase in constipation. And if we have an increase in constipation, this means that we're going to have increased strain on the pelvic floor. We're also going to have an increased risk of urinary leaking because we have too much tension that is going to develop in the back portion of the pelvic floor, which is then going to make it difficult for the front part of the pelvic floor that supports underneath your bladder to be able to contract adequately. And so if we are constipated more often, this actually will increase the prevalence of urinary incontinence developing. So do yourself a favor, you're making sure that you're drinking enough water, but that you're also getting enough fiber spaced out throughout your meals during the day. So we also don't want to make sure that we're bulking with a lot of fiber all at one meal. That's actually going to increase the likelihood of slower bowel transit through your intestines, which will also perpetuate the problem of constipation. So aim for something around 10-ish grams of fiber at each of your meals to be able to make sure that you're getting enough fiber throughout your day to support your pelvic floor. Tip number 5, stop peeing just in case throughout the day. If we are peeing just in case, then we are actually confusing your brain and your pelvic floor's relay system of letting you know when it is an appropriate time to go to the bathroom. So notice if you are going a lot throughout the day on a just in case basis versus going when your body actually indicates the need to go to the bathroom. Lean more towards waiting for your body to let you know so that you can really restore and strengthen that brain-bladder reflex so that it's giving you information when it's appropriate. And that will help improve the strength of your pelvic floor over time and also reduce and mitigate urinary leaking symptoms as a result. Bonus tip. See a pelvic floor physical therapist during your pregnancy so that we can better individualize what you specifically need to help you feel good in your body, to feel strong through your pregnancy, and also to reduce pelvic floor symptoms from being a new normal for you forever. I'll include the link for an online directory where you can search by your zip code down in the description below. Let me know in the comments below which tip you found to be most helpful for you, and be sure to like and subscribe so you can stay tuned for our future videos.